vaccinations through AMI, and I think it's just a steady right now.
So are we like 60% or?
Oh, I can look that up for you in a minute. I'll run in the thing here, so I'll get that information for you.
Are we having a lot of Lyme disease?
I don't believe we've had any reported cases as of yet.
Are we having any West Nile virus?
No reported cases of that either.
All right, thank you for your answers.
We might start asking you those questions.
Well, I don't.
No monkeypox. How about monkeypox?
I don't know anything about monkeypox.
Let's keep it that way.
2 known cases of monkeypox in the state of Wisconsin. We don't know the location.
Okay, any other public comment? I don't see anyone else on there. Okay. Oh, yeah. Oh, Rita, but you're on our committee, so hi. Go ahead.
Go ahead, Rita.
Rita, go ahead if you have something to say.
I don't.
Oh.
I was just saying hello.
Okay.
Public comment.
Very good.
Okay, number 5, receipt of information from supervisors not seated as committee members. I don't see anyone, unless there you want to hop up.
Oh.
Okay, number 6.
I will give these ladies an introduction. So last time we wanted information on the Delta 8. Supervisor McAfee had requested that the information and laws as they pertain to Wisconsin versus the recent change in Minnesota. So we invited Yolanda Candler, who is our Drug-Free Communities Coordinator, and Felicia Fisk, who is our Wisconsin Tobacco-Free Alliance Coordinator, to come and talk to you guys about Delta 8 specifically. I think they'll dovetail some of the stuff that they had in the CJCC presentation, but they will also speak specifically to the question that you had. So I will turn it over to these ladies and I'll get the PowerPoint pulled up here.
Good morning, everyone. As Tanya mentioned, my name is Yolanda Candler, and I'm Felicia Fisk. And today we'll be talking, we're going to touch base on nicotine and then dive into cannabis more. All right. I can Okay, so just a brief overview of our alliances and coalitions that we participate with. So I am the coordinator of the Western Wisconsin Tobacco-Free Alliance, and our mission is to prevent, reduce exposure to, and eliminate the use of tobacco and nicotine products within all of our alliance counties. And we do this through educational work, policy work, and information service efforts. Our alliance covers 7 counties. So we have Burnett, Barron, Polk, Pierce, Pepin, Rusk, and St. Croix. And then our main populations of focus are behavioral health, LGBTQ, low socioeconomic status, pregnant women, rural health, and youth. So I'm Yolanda again. I am affiliated with the Polk United Coalition. And so this is a coalition that's working to improve, make happier and healthier lives in Polk County. And the specific work group that I'm the chair of is the Substance Use Prevention Work Group. So this is really where we are really working to support and prevent initiation of substance use for youth. And on the other side, for the county, I'm the Drug-Free Communities Project Coordinator. So this is a federal grant that we've received and will have for the next couple of years, aiming to reduce substance use, specifically alcohol and tobacco, for youth in 6th through 12th grade in Polk County. So to get us started, we're going to talk a little bit about electronic nicotine devices, because Yolanda will explain how that ties it in later on. So while traditional cigarette smoking has decreased over the last several years, e-cigarette use has skyrocketed, especially amongst youth. According to the National Youth Tobacco Survey of 2021, about 2 million middle school and high school students reported using e-cigarettes, and about 85% of those students reported using flavored cigarettes. So the reason that these devices have skyrocketed so much is because they are easy to hide and they come in a variety of flavors that is appealing to youth. And then when they use this device, they're exposed to the dangers of not only nicotine, but addiction and various new health risks associated with e-cigarettes. And recently, 95% of Wisconsin middle schoolers said that they would not have tried these e-cigarettes if they weren't flavored. And then, so specifically, this is affecting our youth, again, due to the flavors. According to the Truth Initiative, 81% of 12 to 17-year-olds had used flavored tobacco products. And the reason that this is targeted so heavily towards youth is because big tobacco companies spend billions of dollars every year to market towards youth through targeted marketing and endorsements, store placement, and then they are creating deceptive devices that can easily be hidden. And then just some steps that we have taken.
You have one question?
Oh, yeah.
I sneak something in. I don't know if you're aware of this. The newest thing for the vaping devices that they have, kids are wearing hoodies to
Yeah,
school.
we actually have one of those at the county.
Yeah, and they're putting it inside the drawstring.
Stop it.
Yeah,
And so
there's,
they-
you can hook it up on one side and then there's a little pocket that you tuck your drawstring into and then you just inhale out of the
You
other
can sit
one.
right in class and just put that right in your mouth.
It also comes with a can koozie in there with
Yes.
a bottle.
How do they mask the smell when they exhale that then?
It's, you won't be able to mask it. It'll come out as a fruity or whatever flavor that they're
Right.
smoking.
Smells like gum.
They come in a variety of flavors. So some steps that we have taken in the US to really address these issues and make it harder for youth to access these is a flavor ban for e-cigarettes and other tobacco products. This was first initiated in January of 2020, and it limited the sale of fruit candy and mint flavored products. And then to add on to that, we recently initiated a ban in April 28th of 2022, the FDA announced that they were going to prohibit menthol sale as a characterizing flavor in cigarettes and cigars. And then most of us know about the 321 law, which was passed in 2019. And this was a federal law that increased the legal purchasing age of tobacco products to 21. However, this is not passed at the local level, so it makes it hard for law enforcement to actually enforce that law. And then most recently in June of 2022, the FDA authorized to issued marketing denial orders for Juul products that are currently being marketed on the shelves. So that resulted in all Juul products that are currently on retailer shelves to be removed immediately.
That was stayed,
Yeah, and then it was stalled.
the judge over,
In July.
so they're still able to sell.
That was just one type.
One
They just
particular
stalled it
brand.
last week.
Yeah, just one particular brand.
Juul used to be the most popular brand. And it came in a variety of flavors, and then that flavor ban stopped the flavors from being sold, and then it didn't limit the disposable devices like Puff Bar, which is now very popular, and it's half the price of Juul.
Puff bar?
Yes.
Okay.
How is it the state can evade the federal law on tobacco age?
It did not get past this.
Does
Here.
the states have to pass
Yeah,
it?
they have to pass it at a local level.
Okay.
We just haven't gotten to that point yet.
But there is some voluntary compliance with some stores.
Yes. Well, all retailers are supposed to, because they are under a federal license, they have to follow that order, but it's hard for like, if they were to sell to an 18-year-old, our local law enforcement can't do anything to get them in trouble, so.
Right.
Now, This relates a little bit to like with the history of the vaping devices. So in this new generation with Delta 8 and the synthetic like hemp and cannabis, is that we're seeing the transition where they're putting Delta 8 within the vaping devices. That's kind of how it correlates, where it's changing. And then even now within the schools, we're seeing that some devices are containing that Delta 8. And then the reason you can tell kind of the difference, just like offhand, is that Delta 8 is more viscous or like more sticky, like syrup, like you can see that. And then the nicotine juice is more liquid. So then that's kind of the difference there, just right, so then we'll talk about the laws. So we'll start with Wisconsin law. So in the plant industry law, section 9455, so this really defined hemp and kind of started this whole generation. So hemp means the plant cannabis sativa L and any part of that plant. So in hemp, they allow a maximum concentration of delta-9 tetrahydrocannabinol. Tetrahydrocannabinol is the THC or the psychoactive part of cannabis. And in hemp, it can't be more than 0.3% of delta-9 THC on a dry rate basis, or the maximum concentration allowed under federal law up to 1%, whichever is greater. Typically, we see that the 0.3% is a higher concentration. That's usually what they go by because it really depends on like how much is within what they're serving and then how much was within it. So then this is looking at more of a controlled substance. So in statute 961.14 so this is looking directly at what the law has defined as a controlled substance. So they make an exception specifically for tetrahydrocannabinols contained in hemp, as we just previously defined. So as long as it's based out of that cannabis sativa L plant, it would be legal. And as long as it contains up to 0.3% of delta-9 THC. And that again is the psychoactive substance. So then for delta-8, so with these laws that were put into place, it's kind of opened up a new generation of devices. So delta-8 specifically is derived from the cannabis sativa L plant or the hemp plant, and it's supposed to contain up to 0.3% of delta-9 THC. So what we're seeing is that delta-8 is actually containing psychoactive substances. In some of the market research that I performed, what I've been told from people who are selling delta-8 is that it's very much the body high. Delta-10 is also up and coming. That is another strain of cannabinoids that are derived from the hemp plant. And that is more the perceived mind high. And the legal age within the state is 21 years old to be purchasing delta-8. Then there's also another derivative of the hemp plant called CBD, and that is 18 years old. So then delta-8 is not regulated by the FDA. We've actually seen an increase in uptake of severe side effects in emergency room visits. This typically happens after an individual consumes the delta-8 gummies. So what they're seeing is loss of consciousness, anxiety, dizziness, confusion, tremors, hallucinations, and vomiting. So it's very much along the same lines of like when you consume too much cannabis, which is the sister plant, it's having a lot of the same effects. So then for Minnesota law, so this is really where this was just recently passed as of July 1st. And the difference is that so in Minnesota law, they had previously allowed the sales of like delta-8, delta-10, like those things like that. And so where this really distinguishes the difference is that they are now allowing edible cannabinoid products to be sold. So under House Bill 4065, a product containing non-intoxicating cannabinoids, including an eligible cannabinoid product, may be sold for human or animal consumption only if all the requirements of this section are met. So they do have similar requirements. So it's up to 0.3% contained in delta-9 THC or the psychoactive part in the edible cannabinoid product, or as we talk about again a little bit later, is up to 5 milligrams of delta-9 THC per serving or up to 50 milligrams per entire like packet or content. So then another part to it is that where they laid out some additional requirements for edible cannabinoid products. So this product is a little bit different with tobacco and how they typically market. So this is very much where you cannot bear the likeness or contain cartoon-like characteristics of a real or fictional person, animal, or fruit that appeals to children. It can't be modeled after a brand of products primarily consumed or marketed by children. However, there is no mention of can it contain different flavors or anything like that. So there's no control of like whether if a child may come across something like it's strawberry flavored or cotton candy flavored. The same thing in Wisconsin state law with the Delta 8 is that there are different strains that are mimicking the actual cannabis strain. So like Blue Dream that you may have heard of, they are having very similar flavors just underneath the hemp plant. So then also some additional requirements are it cannot contain any ingredient other than a hemp-derived cannabinoid that is not approved by the US FDA for use in food. So this is pretty alarming. Like they've left quite a few loopholes within this law because the only thing that is not FDA approved that they can include is actually the hemp-derived Delta 8 and the cannabinoid, but they're allowing that for that exception, but then nothing else. That's kind of where they're setting it up initially, where that's where a lot of the people in Minnesota are who support cannabis use are pretty excited because within some of this language, they switch back and forth between non-intoxicating and like really emphasizing that where like there's going to be a restriction on Delta 9 THC level. And then some of it goes back to just a cannabinoid where then it doesn't have that restricting of like how much THC. So they change the language throughout the whole law. Sometimes it goes non-intoxicating and then some is just very specific, just cannabinoid. All right, so then some of the final ones, which are also a little bit alarming, is that the edible product either must be prepackaged or packaged at the final point of sale, but it has to be child resistant, tamper evident, and opaque to be protected. And then, however, the requirement for the beverages that are containing Delta 8 and the different cannabinoids. So you may have come across, within our states, CBD drinks with different contents of like typically in that one section of like sometimes it's like tea with like CBD in it. This doesn't limit it at all. So like it does not have to be child resistant. So then they make the distinction and shift between any beverage that contains the edible cannabinoid product does not have to be child resistant. So they lessen the restrictions on those beverages specifically.
Do we know why they did that? Was it they had better lobbyists or?
I am not 100% sure why they did that. Some of the law goes back and forth on whether like they're really distinct on like the non-intoxicating cannabinoid, and then sometimes they go back and keep like a cannabinoid, like they keep it more vague. And I think it's just how the members and the lobbyists ended up voting. And this is kind of what we talked about a little bit earlier too. So this is really just emphasizing that in edible cannabinoid products, it can be up to a single serving of 5 milligrams of Delta 9 THC, and then within the whole package, it could be up to 50 milligrams within like the whole package. But there isn't really any distinction of like whether this would have to also fall under 0.3% or which one would be greater. It really is going to be dependent upon which package, how much is in it, and then basing it off of that.
So, Bill. Go ahead.
When we're talking about this lower level of Delta 9, how does that compare to what people get on the street or in places where recreational is legal? Is it substantially less?
So how it's been kind of defined, so with Delta 8 and Delta 10 was only 0.3% of the THC, where typically on the street, you can either get like 100% or it might be laced with other substances. So there is a considerable difference. However, in the reports that I've been hearing and then the market research where I've gone and talked to people who are selling it and that are using Delta 8 and 10 within Wisconsin, they're very much saying that you still very much get that same high of like with Delta 8, it's more of, I guess, the body high. Delta 10 is more of that mind high. And so a lot of times, or sometimes like what they were recommending to me was that to mix them both within it. And then so you get both that effect because so the main difference between like the street is that you might not necessarily get like the full high, but you're still experiencing some sort of high, but it's at a lesser degree.
Bill, did you have a question?
How does this Minnesota law affect the people living in Wisconsin? Can you go across the border and buy and come back and transport it? Or can you have Minnesota residents purchase it and bring it over?
So with the specific laws, you can go into the state and then buy certain things, but you do run the risk if you do come back and transport it, you're no longer in a legal space. So you could have end up having like trafficking charges. We have seen that in the past where like in Vegas, cannabis, full THC is legal, and where kids, are buying or like younger generation, 20, like college age, are buying like a ton and then bringing it back to their schools driving, and they're getting charged with extreme like possessions and trafficking, where then that's like a very big problem. But like, so if they use it there, it's legal, but then they come back, or like if for like Wisconsin, let's say they go there, they use these edible cannabinoid products, and then they come back and let's say they're drug tested, and they bring it back, they could still fail it, but you can make a distinction, like it's a long process to go through with like lab testing to make the distinction that it was a Delta 8, because the difference, like the small difference between Delta 8, 9, and 10, it's very much of like a molecular level where there's just slight changes. And so with that, like it's gonna have most likely effects on us, but they didn't really get into exactly like if you leave the state, like what happens. But I think that's something that Wisconsin is probably going to start looking at. And then also with that too, with like Delta 8 and 10, it's not necessarily like, so Delta 8 and 10 are legal here in our state. So it's not necessarily illegal to have those products. There's a lot of gray area within our plant industry, like talking about the hemp and then the Controlled Substance Act for Wisconsin state. So I think it's really going to be up to like legislators to start closing holes or kind of like giving power to law enforcement. There's lots of gray area where things could be going either way.
Thank you.
Just,
What is legal in Wisconsin?
it's legal.
So the whole reason that I brought this to this committee is that I got a call from a constituent about how many 18-year-olds and younger are buying in Polk County Delta 8 and giving it to their fellow students. And she apparently had gone to the place up on 8 and just said, hey, what are you doing? You're selling to young kids. And they said, well, we can do that here. We can sell to 18 here. But legally they cannot.
Legally, they can't.
But there's no teeth in the law.
Yep, so that's part of
That's
the,
insane. Oh, did I say that out loud?
So wait, legally they cannot sell? Is that what you're saying?
legally, they cannot. It is 21 years old. It does follow kind of like that for 21 law where it's 21 across the board. There could be like, that's very interesting, but there could be a possibility as well that they're buying CBD where that has, there's supposed to be no THC in that, but with that, a lot of it's murky on like who tests, like looking at like the CBD and like any of the like cannabinoids, very murky on that, where sometimes within like, if you look, we gave a lot of handouts on kind of the breakdown of each law. The test isn't necessarily, so they're at like the hemp farm. So like, let's say there's a hemp farm, I don't know, like within our county, and we go there and we test that specific farm. They don't necessarily have to test all the plants, and then they can also skip that farm. There's a lot of gray area in all of that. And for moving forward though, especially if they are selling 21 or to 18 for adult 8, we definitely have a lot of work to cut out for us to start educating more. So then hopefully we can mitigate any underage sales and prevent youth onset of use.
So, is the loophole at the implementation on the ground level? And are you seeing other counties? What's the differences between all the different counties that you're working with compared to us? I mean, do you even know that question? I don't know.
I'm not fully understanding what you're asking. So,
Because- well-
loophole in regards to which part?
Well, this will.
I think I can
Yeah.
answer that a little bit. So with the specific loopholes, it's on a state level. So on the hemp, so if we go to the, if you go to Wisconsin State Law 9455, so it kind of defines like how the process is for the individual to have a, like, grow hemp, sell it, distribute. But at the ending, so you can tell like more like the negligent 2G, it's on the second page, negligent violations, 2M, greater violations, 2P, felony convictions, is that initially when there is a violation that happens, they usually talk to them, they have so much time to be able to correct it. There's no typical like law enforcement action. If it continues to happen, they, unfortunately with the district attorney's office, they don't necessarily have the power to have that information right away. They can pull it, but they would have to be looped in, whoever's testing it or whoever identifies the violation based on the committee from the Wisconsin state. That's where it gets really murky, is that, or let's say that imaginary hemp farm that we have in Polk County, they violated it, the rule of like greater than 0.3%, and then the committee that the state has, they came here, they tested it, they violated, they corrected it, didn't correct it, violated again up to a couple of times. The Wisconsin state then moves to the district attorney's office and they want to pursue further charges. So there's a lot of loopholes in that where it's still not like they can have that immediate power to have like an enforcement action against them. Does that clarify a little bit? more?
Yeah. So, and then who actually is knocking on the door of those farms, the imaginary farm? Or
Yeah,
the
so-
imaginary Delta 8 store? Is that?
Well, for tobacco, we do compliance checks, but if we do have a sale, they're basically getting a slap on the wrist and a letter that says you did not comply to the federal E21 law.
That's you?
That's for us, we do compliance checks. Each of our county does compliance checks each year. And then for the hemp farm and then kind of at that level, it's very much like this specific, they didn't name the committee in the reports, but there's a committee that the Wisconsin legislature has gathered to then oversee that. But there's a lot of like kind of loopholes in the sense of like, do they have to check everything? Do they have to check everything? So it's very much kind of on a on their own basis of like checking.
You're basically saying people could grow hemp, but grow it at 5% and not 3%. That's kind of what's going on here?
Sometimes that does happen. Typically, they do try to make sure that they are within 0.3% because I don't think that they would like to have that charge. And at least I'm hopeful that that's they're, really wanting to follow that law. But sometimes if things do get missed and they could fall through the cracks where they're not necessarily testing every single one. And then regularly as well.
Hey, Ryan and Rita, do you guys have any questions?
I have a statement.
I think this is extremely informative and I really appreciate this presentation. There's a lot of information I didn't have in here, so that's great. Thank you.
I think
I was gonna mirror the same thing, no questions, but good information and glad that it was brought up to do this.
Thanks, guys. Denise.
They nice presentation. But let me play devil advocate here a little bit. I would be remiss to not be devil advocate in my personality. The shirt I'm wearing right now, Hippie Dippy, is a hemp shirt. Not every farm that's out there growing hemp is focused on deriving cannabinoids to get kids high. Kids will find ways of getting high all on their own. I think I think if I came straight up and asked both of you, where do you want your kids to get their source? I think they going to a tobacco store and having regulated amounts is much better than going to the drug dealer down the street. Right? Because there's other things they're not going to want to mess with just selling pot, right? Do you agree? So I think this is all good stuff, and I have to believe there's better minds working on it. But when we were kids, we called this ditch weed, just in case anybody, it needs a frame of reference that is 60 or my age. Kids will find a way to get high. The problem is that they know it's got a little bit in it. So therefore, they're doing a lot more than they should be, and ending up in situations.
Yeah.
Well, also, I in my research, and you probably said this too, I just maybe didn't hear it, is that there's not a lot of like how they create it, all the additives, all that stuff. That is a total mystery about like what does that do to the body over time, especially a young body and brain. And so to me, it's like, yes, the concentration may be less, but what are they getting with that lesser concentration in terms of chemicals, synthetics, the side effects? And if they're doing more of it, that is, to me, I agree with you that kids are going to find, we just all find a way when we're trying to mess ourselves up in some particular way, we will find a way. But to me, that was a concern that this parent also was talking about, was what else are they getting? And that the FDA has not weighed in on all of that. But, the longer term effects of the synthetics and the derivatives that happen in the process.
Yeah, those are both really great points, especially like keep in mind that there are hemp farms that are, most of them, I personally hope and believe that they are, across the board, maintaining the law. And like there are really great products like your shirt, like throughout that whole thing. But then on the flip side, where the FDA has put out a statement specifically about like the synthetics, so like as you kind of mentioned, they're seeing a lot of different chemicals, like some of them that they picked out are like weed killers, like stuff like that, where it's very much they believe that might be contributing to some of those hospitalizations or ER visits. So it's kind of like you do have a lighter and it's more controlled, but then at the same time now it's very like it's also risky with those other synthetics. So it's just like you have to figure out a way to come together and just have more education and really tackle it in all.
Any others?
When did Wisconsin pass this law regarding hemp? Anybody know?
Well, there was a federal law in 2018 of the Farm Bill. I'm not sure exactly when this one was passed, but I imagine it was very similar to them, but I can look that up and get it back to you.
Yeah, there's parents said it was part of the Farm
It's like
Bill
3 or 4 years.
2018.
Is there any education being done in schools that you know of?
Absolutely. There is two things. Number one is not all kids are going to get high. That's the norm. And if they do get high, there are definitions of that educationally all the way down the line. The other thing is that, the presentation that you guys are doing and the information that you're putting out is absolutely wonderful because you're basing it on fact and it's not based on fantasy. The law always has loopholes in it, no matter what you look at. And until those regulations are met, even for tobacco purchase, and there is more enforcement on that to make those individuals who are the entrepreneurs that want to make money, they don't care what the age is. There has to be more than a slap on the wrist. Now, Felicia, when you say that these business owners are getting that slap or a letter, is that letter coming from your office?
Yes. Well, we partner with Wisconsin Wind, the state program. And basically if we have 2 youth that go in and then you have an adult facilitator. So if they sell that day, we walk in with the letter and give it to them right after they sell it.
Okay, but my question is, not, and we just had this conversation before with Millie when I first came in. So if I sent a letter out from my school district indicating that somebody was truant from school, parent looks at the letter and goes, don't leave it, who cares? Unity High School, okay?
Yeah.
If I send a letter out from the corporation counsel's office or the district attorney's office, ooh, I might pay attention to that.
Yeah, Colorado publishes them in the newspaper.
So I
Yeah,
think,
there's a couple counties that can't specifically call out the retailer that sells Lyme because it's.
Why is that?
A big issue, but it's the pushback from retailers and the. But you can count
oh,
out
the
and say
lobbyists,
this
the
area
lobbyists
in this
again?
town has a retailer that's selling. But yeah, we're not allowed to call out. classes.
Well, and you stop and think about that, Wisconsin's strange.
Yeah.
It used to be Miller Park. What is it now, American Family Park in Milwaukee? And if you sit in the park, you can see the Miller sign. Look across. So, but again, I compliment both of you, and it's tough to put teeth in the law when there are so many loopholes.
Mhm.
But I give you lots of credit for what you do. Thank you.
That's high praise.
Well, and
I agree
also,
with you.
I'm curious about, I'm gonna call this person back and maybe out of your sort of range, but I'm just curious if parents are worried or there's citizens that are concerned. Okay, so there's the law and there's you all, but if families want to like get up in the faces of these retailers who are selling to kids tobacco or Delta 8, they just like picket, show up, make noise, be jerks about it.
Yeah, so we can't lobby.
No, you
because we're
can't.
kind of an estate, but
Yeah.
I'm
But
not saying they can
citizens
do whatever they
can
want,
do
but
what
they
they-
can make a.
yeah. they could make their discombobulation, and I think they already have, but
Even
they don't have any, there's like not a lot of, there's like really not, I think she was asking about legal recourse, or is there any enforcement? Or is there any legal thing that can happen? And what I'm hearing is no. So I'll just call her. Hi, no, thanks, okay.
Contact your local legislators.
Well, and the other thing is, writing, for what it's worth, putting an editorial in the paper,
Yeah,
writing,
We've
and you don't have to
had-
call out anybody specifically,
Public shaming, yeah.
but you're gonna make a comment about those illegal
yeah,
sales.
or we've had alliance members in Pierce County. They've had a couple retail stores that it was about the store placement. They're placing it at youth access. They've written to that store multiple times, and then I had a bunch right to corporate for that overall store about the same complaint, and they called out the exact store, but I can't call out your.
Sure.
Thank you.
So on that same vein, you guys don't have to answer this right now, but maybe you want to think about if there's anything that we can do at the county level. If there's a resolution that you need, call Barbara or me or Tanya. We would be certainly happy to kind of help in whatever way the county level can do. So just think about that.
No, thank you much.
Do you have any programs where
Yes, Fran.
parents can get education?
We provide various PowerPoints. So like this one was catered to you guys, but we have one that is for substance trends. It doesn't only touch base on Delta 8, it touches base on vaping devices, Delta 8 marijuana, regular marijuana, along with alcohol and other substances.
And then with that too, we kind of touched on, you mentioned with the sweatshirt, we have an exhibit that also ties in, which looks at those Delta devices, looks at like, there's also like a water bottle that you can use and it's a vaping device. So it's really looking at all those different stealthy devices and educating parents on how to identify.
We set it up as a mock bedroom, so we call it our vaping, well, we've changed it now. So it used to be the hidden in plain sight exhibit, but we added it in and we have a vaping backpack, that sweatshirt, and then all the other deceptive safes and Delta 8 products. Then we recently got a vaping exhibit for high schoolers to use, or middle schoolers. So it's an escape room that they go through and learn about topics.
Do we have any data on for the whole world of gateway. Does a kid who's vaping nicotine then move to what? Cigarettes?
There's no-
Marijuana. Thank you. I was like.
I would say there's no like current data right now because of COVID. And then we did do the YBRS, which would have some of that information in there.
But unfortunately, that is not released yet for like the county-wide, for Polk County until like December, November. It's a little bit delayed for the year of 2021.
Can we have that come back?
Youth risky behaviors survey.
Yeah. Yeah, I had that come across as a parent. I saw that.
Middle and.
Middle
So
and
break
high
it down to one section middle school, one section high school. There's the overall state one, we can look at, but they haven't officially released the Polk County, like all the schools together.
And schools could choose not to participate in that. I know we have one school that did it.
Okay. Interesting. In Polk County. Yeah, okay. Can we have that come back to us in November or whenever, what'd you say, December? So whenever you're, what do we call that? Risky behavior survey?
Youth risky behavior survey.
We can get that back to you and then
I
I
can
can
also
also
share
share
some more information on those specific substances or like other things that are within that synthetic Delta 8.
Our contact information is on the last slide too. If you have other questions,
Thank you so
don't go
much.
back to your agenda.
Thank you. No, thank you. You guys
It was
were
our
very good,
agenda.
so.
Thank you.
Okay. We have the Golden Age Manor up next.
I believe Dana is on virtually. Send her an email.
We can always just loop back with her.
Do you want to flip flop with
Yeah.
veterans?
Good.
She said she was on, so.
Okay, then we're gonna go on to veteran service and then come back. Oh, is she there? Okay. Okay.
Hello.
Hi, Dana.
Hi, can you hear me?
Yeah, thank you. Go ahead, the floor is yours.
You're muted.
Can't hear you.
There we go. Now can you hear me?
Yep.
Okay. Hello, everybody. I'll just give you a brief update, and if you have any questions, let me know. So Golden Age Manor, Dana Reese, administrator here. Just kind of some of the general information. Currently, our census is, we're kind of holding steady around 65 to 70, which is where we're comfortable right now with our staffing. Staffing, of course, everywhere is a challenge, but in healthcare especially, we, need the people. We can't do things without the people. So that's our biggest hindrance right now to our census numbers as well. The referrals are out there. The hospitals are begging, for help taking these people, but we're currently taking what we can based on our staffing. We do have a number of long-term staffing traveler contracts. The state of Wisconsin has a DHS health staffing program, which is through the end of August. So we have a few folks here through that, which is a cost share with the state, as they pay 60% of that wage. We pay 40%. So that's been really great. I wish that was going longer, and hopefully we'll come back. We're currently in the works of putting out a nursing recruiter position, a part-time position. We're using some FTEs that are already in our budget for that. That's kind of what we're seeing out in the world in healthcare and long-term care. The recruitment and retention piece for especially the nursing department is taking an enormous amount of time and energy because of where we're at with the workforce crisis and these contracts we're getting in. So we're putting that out hopefully this week. That'll be a 20-hour position. So I'm excited about that. We're also looking at some early stages of some international recruitment through some of our state associations. COVID here, of course, we continue with the most restrictive policies and everything through CDC and CMS, and we work with public health on all of that. We continue to see some cases here with over 100 staff people. It's not a surprise, and the fact that we're testing all of our unvaccinated staff or those staff who are not up to date get tested for COVID twice a week. Everyone else gets tested once a week. So this is just crazy. It's been 2 years that we're going on here now being tested twice a week. So of course, even in the hospitals, they don't test staff. So of course, we're going to find the COVID cases here, which is good, but it's a lot, just a lot of rules and regulations still around COVID for us. But we continue to keep those numbers low. We're still requiring masks for all staff and visitors. Residents are encouraged, but not required. So again, we just hope for a little bit of relief in some of those COVID protocols. For example, we still have to isolate our residents if they have COVID for 10 days, where the general public is 5 days. You know, our staff can come back to work after 5 days, but the residents are isolated for the full 10. The last few COVID cases we have had with residents have been very mild cases, thanks to the vaccine and some of the antiviral medicine that they can get now. So that's been really great, that they are minor, very minor cases, very minor symptoms. Sometimes we only know because we have to test them once we get a positive case. So they might not even have any symptoms, but we test them anyways. Any questions on any of that? That's kind of a really high overview of kind of what's going on right now, but COVID continues to take up a lot of our time. So yeah, questions?
But yes, about what percentage of your staff are unvaccinated?
We have about 25% of our staff that are unvaccinated who have a religious or medical exemption.
Okay.
Yep. We have about 90 to 92% residents that are fully vaccinated.
Thank you.
Yep.
What are you gonna do? You mentioned this program that's running out in August.
Yeah.
What do you do then after that, when you lose those staff?
Well, then we can still get the staff. We just have to pay for them 100%, which, you know, we're just having to do right now based on where we're at with staffing. So the staff are out there through these traveling companies for the most part. It's just going to cost us more money.
I see. Okay.
Yeah.
Got it. Any other questions? Thanks for popping on. Appreciate it.
Yes. Thank you.
Okay. Now, Andy, you.
Sure.
Well, never mind. Psych.
So I really only have one update that I want to talk about. So Gail from the Veterans Office, she's been working on a project trying to bring awareness for proper disposal of the American flag. I think some people still throw them in the garbage, things like that. I would have to assume also that a lot of the newer flags, based on the materials that they're made of, even if they're disposed of properly, it's probably not very good to breathe in those smoke fumes. So Gail worked on a project with the local funeral homes throughout Polk County to where we will donate used flags that need to be retired to the funeral homes. And then if they have any veterans that are being cremated, that flag can be cremated with that veteran. So based on US flag code, proper way to destroy a flag is by burning. So we're kind of paying respect to that veteran and that final respect to that flag by placing that in with that veteran as they're cremated. So pretty neat program. Yeah, we've our goal is to, once the construction is done, get a nice professional flag drop box, I think at the front entrance at the government center. Right now we have like a corrugated plastic one in our office, which is nice, and people can bring those, you know, those flags in to properly get rid of them. That way they can be destroyed.
And how many flags are you processing?
So we just started this program. So we haven't had any requests right now because it's all just based on as a veteran dies and if the family wants that. But the family will also get a certificate that we will provide to the funeral homes that also it's essentially recognition for that American flag, you know, its final duty and things like
I
that.
see.
Can I make a comment or ask a question? Thank you. The American Legion right now is collecting flags at they have a drop box at the entrance to the hardware store there in Balsam Lake, across from the government center there. And the burning happens by some of the individuals in the American Legion. They dispose of that. But if they knew about this program, they get a lot of flags.
I don't know where the camera's at.
Turn around. There you go.
And that's a great point.
I'm just, the contact person for that local post is Stephen Dubois. And he currently collects those flags from the box in front of the hardware store there, probably on a weekly or every other week basis. So he would be a great person to coordinate with in terms of getting flags.
I believe Gail has. So Gail was supposed to reach out, and I believe she has, to all of the service organizations. So the American Legion Post VFWs, we've already received a big bag of flags from the United VFW just north of town here. So the service organizations are aware of what we're doing as well.
Okay, super.
Because a lot of those service organizations, for example, like St. Croix Falls American Legion Post, they'll have a flag burning ceremony generally around Memorial Day, which is fine. But a big part of this is just awareness. You know, don't throw your flags in the garbage. You have a proper place to dispose of them. There's a purpose for it. So that's what we're trying to spread the word on.
But you also had an interesting point, which is that flags are now made out of more synthetic. They're not cotton anymore, right? So
No, I
that
would
was your
have
point
to
about
imagine nylon and all kinds of other things that are
burning
toxic.
plastic. Yeah, that's not great. Any other questions?
Thank you.
Great project, okay.
I also want to mention that he was a speaker for me at Rotary a month ago, telling our Rotarians various issues and help for veterans. So he did a great job. So thank you.
Absolutely, anytime.
Okay, number 9 is Tim Anderson talking an update for the public transportation study.
Can I just, before you start, Tim? I need to stand corrected on the Lymes. We do have some reported cases. I checked back with Mothership and they said there are some cases, so I was wrong.
Thank you.
Good morning.
Morning.
Thanks for having me, as usual. It's a quick update here. I think the last time I kind of gone over what this full study was about. Just a quick update for you. We have worked as staff with Regional Planning, who is our consultant on this project, to finalize the survey questions. They are ready to roll. We're meeting this afternoon as staff to talk about the ways that we're going to disseminate this and advertise this online survey. We will also have paper copies available in certain locations, like probably some public housing spots where we think that people that might not have direct internet access and might be utilizers of this service can get and fill out those surveys. We can get them back to us. The survey will be out for about a month, and it should be released in the next week or two. I would have a firm date, but regional planning staff has been out with vacation. So they'll be back later this week and we'll confirm that exact time for the release of that survey.
Can we just get an email of those? Just pop one, the survey in our email? That'd be interesting. Okay.
Yeah.
Rita, do you have something to say?
I'm just agreeing that would be great to have one in the email.
Okay.
We will send you guys an email.
Anybody else?
Tim, did you say how many surveys you were gonna send?
Uh,
Is it available electronic
Yes,
and,
yep.
and mail?
Yep. Well, not mail, but we're going to have paper copies available in certain locations. So we'll have online and paper copies. Yep. So unlimited for online, whoever wants to fill it out.
Are you marketing this? Are they marketing it to like the libraries and?
That's part of our conversation this afternoon, but yeah, we're gonna work on those spots. Facebook, probably hopefully.
Because the libraries could also facilitate paper ones.
I think we'll have a press release too.
And hospitals, I would suggest also,
Yeah.
and clinics.
Some of the people that we have on the,
Marketing, we have marketing people on that.
right.
Thank you.
That's what I have for you. Yep.
Awesome.
Thank you.
Thank you. Dr. August has to run out, so thanks for coming.
Thank you so much.
See you, Doug.
2022 budget priorities?
Right, so we had asked this committee to bring us any feedback or topics for priorities for the 2023 budget. It's the 2023 budget planning season that we've officially kicked off. Officially, unofficially, it's a year-round project. If you read the newsletter, you know that. So I would just ask if anybody has any priorities that you're hearing about in the community that you want us to focus on with our planning. I know that we are looking at the Families First Act and what that's doing with our budgets. It's increasing, it's driving our costs up for placements, child placements. So we're aware of that and we'll be planning for that when we look at what it's what we're allocating for DCF and the client services portion of our budget.
Well, this topic of the Delta 8 piece, I don't know what we can do in our budget to support that, but it'd be nice to look at that in some way or talk to these guys if there's a need or something. I don't know what that looks like.
Agreed.
Help
You
or-
mentioned the hidden in plain sight and comms with the parents. Parents talking to their kids. That's how you're.
Yeah, I mean, some of that, I don't know if it's more public education that would be helpful or, I don't know. Maybe talk to Tanya.
Yeah,
We can meet with Tanya.
the other thing that we're seeing, I think maybe as a result of COVID, our increase in emergency detentions. I think Malia could vouch for that compared to the last.
As a result of COVID?
Well, of the last few years, we haven't had very many, but now we're seeing an uptick in this year with COVID emergency detentions. We're seeing it in our budget lines with Winnebago.
Emergency detentions in meaning like.
So that's when somebody's in the community and having a mental health crisis that makes them dangerous to themselves or others. And law enforcement brings them to an inpatient locked facility. Unfortunately, oftentimes they're going all the way to Winnebago because it's a state facility and they're obligated to take them regardless of whether or not they have room. And so we're blessed to have Amory Behavioral Health in our community, but they have a limited number of beds and a lot of other counties have folks going there. So in those rare opportunities when we get to bring somebody to Amory, that's great. But there's an issue. There's a shortage of beds, shortage of providers. There's our sheriff's department, I think, is highly responsive to mental health crises, and they are highly educated. They have counterparts in behavioral health and our mobile crisis folks that we contract with to make sure that they're addressing mental health crises in the community in a thoughtful and compassionate manner. The same is not true for all of the municipal law enforcement agencies. They just don't have the same level of training. And so, it's sad. And in addition to law enforcement, there's two other ways in which folks can be detained involuntarily. And that's if three adults come into my office, meet with me or Joe, and there's enough to take in front of a judge. Or if somebody goes into an inpatient facility in a crisis and then says, I'm going to leave, and they're not safe to leave, the facility can initiate.
Because I know you get to transfer.
No, hard line.
I know there is some COVID related dementia.
And there's also a disconnect. I mean, this would be a great topic, actually, because I could go on for hours and it's not on your agenda, but putting this topic about mental health and degenerative brain disorders and how that impacts our community in crisis. I would be more than willing to give an overview of like the law and our limitations and then what we're seeing here on the ground.
Next month.
Are you able to do it next month or do you want a little time?
I can do it next month because I think we're also putting child support on. So I can be there to support Nikki with that too, so.
Thank you.
There is hope though with the Heidi Health Systems, is it Heidi Health or St. Joe's and Sacred Heart. They are adding some juvenile beds and adult beds in this region, but I don't know when what the completion date is, but that legislation was passed. So we will have some local, but they'll be filled up as fast as they can open the doors.
We really lost out when Cumberland closed their doors many years ago.
Tanya, was that what John was updating us on last time?
I think so.
He said something had passed the legislature. Oh, okay. Okay, so well, thanks, Tanya. Good idea. Okay, do we have a legislative report? It's on.
I think he's gathering it right now as we speak.
He's down at the WCA steering committees last week and this week.
Oh,
and
got
I think
it.
one more next week. Yeah, so he'll be coming back.
Okay, so we'll just put that for next month.
Can feel it happening.
Yeah, go, John, go.
Thank you, John.
Okay, do you want to do an update on staff vacancies?
Sure. You had requested an update on the nurse vacancies last month. So I just thought I would give you an update on the entire division.
Yes, thank you.
If that makes sense and you're okay with that. And I know Dr. Lagas you said he wanted an update on the health officer position, so I can give you that as well. We have had 2 pretty ongoing recruitments for a behavioral health therapist and substance use counselor. Originally, they were 2 therapist positions. We have not gotten any applications. We got creative and changed one into a substance use counselor. I think they had 1 applicant last time, but they, just to try to get a better pool, I think they extended the application recruitment on that. If you're on our NeoGov at all, you'll see that a new economic support specialist position just opened up. And that is due to one of our longer standing economic support specialists announcing her retirement. So we're very happy for her. The consortium drives when we fill those. We just have the allocated FTEs. They're usually fully funded by the consortium. So we're able to just get those recruited right away based on the recommendations of the consortium. In public health, we are onboarding a new public health nurse on July 25th as her start date. So I'm very happy that we got a 4-year RN who accepted an offer with us. Over here in the jail, that's been a long-standing recruitment as well. Some creative thinking on our administration part to kind of customize that position a little bit. So we were able to reallocate some of our behavioral health nurse time over here. She's taken a lead as a coordinator over health and behavioral health, mental health, while we are onboarding a student who is getting her RN in 1 year. So she's just got her LPN. She'll be working with us, I believe, up to 16 hours a week while she completes her last year of schooling. And then once she is official with her RN degree, she can roll right into the full-time RN position that we have here at the jail. So totally non-traditional, out-of-the-box thinking, pulling them right out of school. She has an interest and passion in corrections. She was in jailer school, correctional officer school at a university that ended up having to close their doors. So she ended up wanting to change over to nursing. So this is really a kind of a neat fit for her. So we're excited about that. We also have a public health generalist position open. It's not being recruited right now while we figure out when we can get that rolling with the recruitments. Health officer, we have Helen is our interim appointed health officer. Helen Swanson, she's a speech therapist for the Birth to 3 program in public health, and she has expressed some interest in trying out the health officer role. She meets the credential. So we are in a 6-month hold at least, just to do some healing and rebuilding of the public health department with a interim assignment at that time. We will do some analysis of that and how it's going in 6 months, and then decide on the full recruitment. And we're working hand in hand with the state on this. So they've blessed her to be the interim health officer and, supporting her in that role. We are interviewing for a case manager position in behavioral health soon. I think that's about all we have open. Can you think of any?
Not that we're actively.
Not that we're actively recruiting, so we're always analyzing our positions and how they fit in best with the needs in the public. And so we can do
So
some.
the jail one was really, that's so creative. So basically, a passionate student wanted a job when she got out of school, committed to Polk County. Kind of tag teaming both things, and then we'll roll right into it. And
Right.
Were they on board with this concept also, the jail, I mean?
Yes.
Or was it
well,
maybe it's their idea, I don't know.
We did this previously with one of our foster care coordinators. She was more of a intake specialist and wanted to get her bachelor's degree. So she enrolled in school, and while she was getting her bachelor's degree, we had her in the foster care coordinator role, supervised by our staff. So she stayed at a lower pay grade while she was working her way into that position. She has since obtained her bachelor's degree and is getting her social work certification. So she graduates up to the social worker level of pay that is the foster care coordinator. So we were able to, she identified a need, a want and a desire of hers to get that degree, and we were able to bring her up through succession and put her in that higher level pay, higher role once she got her degree.
Very good. Very good.
Sorry. Go ahead, Rita.
Oh, that's just brilliant. That's a beautiful thing. Both of those case examples. That's wonderful. That's all.
Do we have to pay signing bonuses yet? Like they do in the medical world?
They are not doing that at the county yet.
GAM has.
GAM has done some.
GAM has?
And I think that's been going on for quite a while. Vince, do you know
I'm sorry, what was
the sign-on bonuses?
Do we have to pay, are we paying signing bonuses yet, like they are in the medical world, just to recruit people?
No, not in the county government here. We had tried some of that over at, we did that for a while at GAM to get some people over there, but we do not have sign on bonuses. We have, I will say this, I mean, it's a national problem and it's a county organization problem that we are adapting everything from our policies and procedures in how we recruit people, how quickly we hire. We are eliminating a lot of the process administration. You know, we had to put out a recruitment for so long. We had to get so many people, we'd have to set up a committee to interview them. And by the time you got everybody's calendar gone, it's been 3 weeks.
And
then we call them up and they said, oh, I've already been hired.
Yeah.
So we are speeding up those processes. We are also loosening, we are altering some of our approaches to appeal to them. So whether, we may not have the money to do it, but we are offering things like, PTO available right away and those types of things. We're doing different things, and it's tough everywhere. I've been very pleased, and I'll be able to update pretty soon some of the openings that we've had. I think we found some good candidates. We feel very good about people. But this is going to be a major challenge for the county over the next year or two, is how do we get the quality people and how do we retain our quality people? So that's the other thing we're working on.
St. Clair County Sheriff just posted a $5,000 sign-on bonus. That's how much trouble they're having too. So.
Yeah, and certainly that's an option. Our challenge, when people come to me and say we have a problem filling a position, first thing they say is we need more money, offer us more money. And that won't work for a county government like this, where you start paying people more, because then you got to pay everybody more. And then before you know it, the economy changes and we're in trouble. We got to lay people off. But certainly we will include wage and those types of things. We're also looking longer term at a bonus structure. But to me, when I interview the people who work here and talk to them, what's unique about them is they say things like, well, the reason I'm here and not a private company is because I like giving back to my community. I like being involved. I like helping people. I grew up. And so what we're going to try and do is provide a better environment for them to work. Brand the county as a great place to work. And if we can get people to say, I can look there for the county, or I can work at that factory where they're all sitting around a dumpy picnic table smoking cigarettes. I'm exaggerating here. But if we can brand this as a place that looks appealing, that we pay attention to our employees, we're concerned about their health, we do things in a way that will make them more comfortable here. I think we're going to be able to compete with hiring.
Well, and I think the PTO is good, because the age group that I'm talking, you know, the 20, 30 or young 30s, they don't want to come and work for 2 weeks a year. So that might help. That might sweeten the pot a little.
Yeah, and we are, you know, evolving as we speak and kind of tweaking it as we go. So it's not can't say we've got all the answers yet.
You want to explain what you handed out, or was it all self-explanatory?
Supervisor LaPre, you had requested information on us promoting boosters. So this is what we've got. We don't discriminate any type of vaccine for COVID. We just come as you are. You can get whatever you can get any flavor through AMI. They come on Thursdays. It could be first dose, second dose, booster 1, booster 2, all that. So that's out there. And then just that resource guide that they had worked on to show where else you can get the vaccine if it happens to not be on a Thursday that you're needing it.
And it's not on this sheet, but it is on this, and we are doing down to 6 months.
Right. I put, yeah.
It is on our resource guide, but AMI just doesn't update their stuff
Okay.
only monthly, so they are seeing down to 6 months for Pfizer.
6 months now.
What does AMI stand for?
Oh, that's the burning question. So
I think Tanya texted me it before I came over, and I'm like, what does AMI stand for? I'm not sure.
Okay,
It's
I can-
just their name
Okay.
from what I can see, but if you can find it,
Okay, I'll let you know.
you're better at Googling than I am, I guess.
The American Milk Institute.
I just checked. Yeah, so there's a lot of AMI out there, but AMI Health, even on their website, it doesn't say what it stands for or anything. So
it's a nationwide staffing pool. Right now it's funded by the state.
it might even be
Medical staffing.
Oh, it's a
worldwide.
staffing pool. Okay.
Yeah.
Oh, okay. Well, that helps. That's all I need. That's good.
Medical. American
Bill.
Medical.
Institute, I don't know, but that's just, it doesn't say on their website, so.
Okay, Bill has a question.
But no, I just want to make a comment. Tanya, I want to compliment you on the newsletter.
Yes.
I sent you a note back. I think that the thing that I like about it is you're including every department that you have, and you're introducing staff. You're giving credit where credit is due to people, you know, and I think that's important. I think from a PR standpoint. So my kudos to you and your staff.
I shared your comment with our staff so they know.
I got a couple comments back. They emailed me right away, but and I appreciate that because it's interesting. You know, that workforce, they work hard and they should be recognized for the things that they do.
I'm just glad people are reading it.
Yeah, they are. I mean, you know,
Absolutely.
and I kind of look forward to it because,
Did you have any
geez, it's an
typos
update.
in this one?
Nobody caught a typo this time. So
I looked really hard.
I'm gonna start putting one in there just to challenge you.
Have her proofread it.
That's what I used to do to my proofreaders, and I throw something in there.
Oh, I think it's proofread plenty. Many people read that and your brain reads what it.
I
what
think we should
wants
have
to
it be a
read.
contest. Put one in.
Yeah, finding Waldo, you
See if
need to
somebody
put a
can
little
get it.
Waldo thing in there someplace,
Yeah,
or
where's
something
Waldo?
related to that.
You know, a giant candy bar.
Remember the toothpick in the Taste of Home magazine that they would hide? You got a prize? We're gonna start doing that.
Okay, good, I like it. Okay, so next meeting, subject matters, I think we have 2 topics from Malia, the degenerative brain disease / COVID, fog, blah, 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 and child support. And then all the other things that you come up with. Is there anything else that the committee members want?
I just have a general question. Do we have a problem with homelessness in this country?
I mean, yes,
I mean,
I would, Tanya may have a good vibe on that. What's the story on that or not?
Yeah, I mean, it happens at our place all the time. It turns into a crisis. They're homeless. And we had been in the process of forming that work group, but one of the key players might not be available to us. So I have to re-engage our extension partners to get a different person in that seat. So it's just kind of been an ongoing comedy of errors with getting that work group up and running. But it is a priority. We've got staff identified in the behavioral health unit because they show up at their door.
So there are times when folks end up in Polk County and they're not necessarily from here, but they came here to visit somebody or they're passing through and their circumstances are that they're homeless. And they often show up through that emergency detention process or other crisis interventions. And then there's a fight about, well, who's responsible financially for them? And if they're from another county in Wisconsin, there's a system in place. But if they're from, wherever, then it becomes, we have to take care of the people who end up here for whatever reason.
Could you add a third thing to your spiel next week and just touch on the homelessness piece and maybe just about this work?
I mean, I can just speak anecdotally about how it interacts.
Should we have?
Or is it time yet?
You want to wait?
What type of information would you want? Like the number of homeless people that we know of, or?
Do you have?
I mean, there are shelters in the county, there are referrals. I don't know of anybody that is, like you would traditionally see in downtown, wherever, somebody on the street holding a sign. I mean, we don't have. It'd be maybe better to do it later once our work group is up and functioning, to come back and report regularly to this committee. What we're finding
And I have a friend who is, has been researching rural and suburban homelessness. She lives in her van, by choice, and has for over 15 years, and just drives around and documents their stories. She's kind of that's her mission. And she recently wrote a book. She's written a couple of books. She helped write the McKinney-Vento Act, which lets kids stay in the same school district, even if they're homeless. But I'd be happy to connect when it's right. Actually, I'll just send you her website, because she has all these videos just available. And maybe it's you don't need more knowledge, but it's just, she'd be a great resource for that committee if they want her.
Yeah, McKinney-Vento's been around for a long time, that legislation.
Yeah.
The reason I say that is, do you have any contacts with the schools at all in the county regarding homelessness? Tanya, do you know that? And I don't know what the confidentiality there is, but I know that there are families that come in that register kids, and those kids basically are homeless. I know that for a fact. And they have, they give you a post office box as an address, and they're living in a park, someplace in a van or in a trailer.
we do see some through DCF that are homeless, or the report will come in, homeless family.
Right.
Some of the schools have homelessness liaisons. I know Frederick.
Yes. And, and I know, well, and again, I'm not picking down the road here, but the school down the road here with a social worker, that helps an awful lot. And with a liaison officer, because then you get that combination of parents are housed over here and the kids have no place to go. So, they run into that. And you don't get that public information an awful lot.
Right, so I like systems in place. And so you have a pocket for homelessness. If you recognize it, no matter where, it comes to a central location and then gets coordinated, I guess you could say. And
a lot of times the kids will end up in hopefully they can get them into foster care someplace, just temporary.
Right. I guess I was just asking that just to find out if we have a process in place as a county to do that. You know, if it is one of those, you go to Eau Claire, you're gonna see those people. And every time I look at a homeless person, first thing that pops in my head is if they're single adult, I immediately think of military, because that's the, that to me would be the worst. Then I consider substance abuse, and then I consider mental health issues. So there's various reasons why. Domestic abuse, it goes on and on. So whether it's a small part or a small issue in the county, it still will manifest itself. And then how is it handled? That was what was driving my question.
And you don't have to go to there, come over the eastern side of the town, or western side. We have, I think that kind of quarter, St. Croix Falls, Dresser, Osceola. I see, not a ton, but often enough. Just yesterday, I was driving, went around a car, and I was like, oh, that stroller does not have a baby in it. I mean, not a car, a stroller in the street. And I was like, okay, so we'll add homelessness in a couple months whenever your work group.
New terminology is unhoused.
Yes. Okay, thank you. Anything else before we adjourn? I'd take a motion if not. Second. Thank you, everybody.
Thank you. On the agenda, it says number 10.